So across countries, there's a strong positive association between per capita dietary sugar intake and various forms of cancer. Therefore, sugar probably causes cancer. Right. There's a couple of issues with this argument. One of them has to do with the fact that we're looking at countries rather than looking at individuals, but let's skip that issue. That's an ecological correlation question, which we'll come to in the next chapter. But what about this argument? What else? I mean, is that evidence that sugar causes cancer? I mean, there's an association. Okay, there could be confounding factors, right? Confounding is a term of art. There could be something else that produces both the higher sugar intake and the increased cancer incidence, or at least cancer diagnosis. Right? What are some things that we kind of believe influence the incidence of cancer diagnoses? Doctors? Having more doctors? Okay, so to some extent, better health care, better chances are you get diagnosed with something if you have it. Okay, first world countries, more likely to get certain diagnoses than third world countries, whether you have the disease or not. Okay. Cancer, by and large, is a disease of old age. You live long enough, you're going to get some kind of cancer. Not necessarily one you'll die of, but okay. So if you're in a country with a long life expectancy, then you will likely live long enough to get some kind of cancer. Okay? Just saying, yeah. Okay, so, and where's sugar intake high? Wealthier countries. Okay, sugar and fat are expensive on a global scale. Yes?
Well, that says dietary sugar. Is that referring to like Splenda or something like that?
No. In your diet, things you eat. Yeah, dietary sugar intake meaning sugar you eat rather than sugar you wear on your body or something. Yeah, sugar in your food, sugar in your diet. Okay, so sugar, especially refined sugar, is relatively expensive on a global scale. So is fat. So is protein, right? Carbs are the relatively cheap thing. So sugar intake is associated with wealth. So is longevity. So is medical care. So is a lot of other things that go along with that. What else might be associated with wealth that could explain this association? So there's sort of the hidden variable here, or a hidden variable here is wealth, affluence of the country. Yes? It can be affecting both directly and indirectly. Right. So some people think stress leads to cancer. Okay, I don't have an opinion, but if you think that the stress of sitting in traffic is bigger than the stress of wondering whether next year's crop is going to come in, then maybe stress is associated with wealth as well. Yep, sorry.
Some people think that cell phone use increases the risk of cancer. That would be a little.
Okay, so if cell phone use causes cancer, and I think the evidence for that right now is pretty weak, but doesn't mean it isn't true, then more affluent countries have more cell phones per capita, and that might be causing a higher incidence in cancer as well. Yes?
Are we talking about any kind of cancer? Like, what about like exposure to the sun?
Exposure to the sun. Okay, so skin cancers, it's hard to tell which way it would cut. The question is who spends more time outdoors at peak solar times. I mean, I think a lot of the more affluent countries are actually less equatorial, and so it might be, and also less agrarian. So it might be that would cut the other way. I'm not sure. Yeah. Yes.
Obesity.
obesity. If obesity leads to cancer, I mean, people believe it leads to heart disease and cardiovascular disease in general. But if it's linked to cancer, then okay. Some people believe that fat intake causes cancer, especially animal fat. Well, the countries that can afford sugar are the countries that can afford fat, to a large extent. Yes.
Cigarette smoking as well.
Cigarette smoking. Okay, there again, there's a certain level of affluence that's maybe necessary to afford cigarettes. I don't actually know what the statistics are like across countries. I think that in more developed countries, cigarette smoking is decreasing compared to what it is in some less affluent countries, at least. But clearly, if you're in extreme poverty, you don't get it. Yeah. Other ideas? Right. So, association. If there isn't an intervention, right? If we didn't basically take some group of people experimentally and insist that some of them eat more sugar than the others, to pick a subset of them at random, give some of them more sugar, some of them less sugar, follow them for a number of years, and look at what happens to the incidence of cancer among those people who were sort of nominally the same but only randomly assigned one treatment or another, then it's very difficult to attribute differences in the outcome to differences in the sugar intake, because a whole lot of other things go with that. Right? That's not the only factor that differs for these groups. There are a lot of other factors that differ from these groups.